Psoriasis is a skin disease that affects millions of people worldwide, yet it has been historically one of the most misunderstood diseases. It has been confused with eczema, lupus, boils, vitiligo, and even leprosy. You can imagine the psychological turmoil past victims of this highly visible skin disease had to go through, some even being shunned from society as lepers. It's only been in the past 2 centuries that we've made some great strides in understanding this very complicated and debilitating skin disease. In this webisode, we'll cover the biological basis of psoriasis, or what truly causes the disease, and what it looks like on the skin. Then we'll go through some available medical treatments and how you, the therapist, can help manage this disease. Psoriasis is a chronic, inflammatory, multi-system disease affecting 1 to 3% of the world's population. It is characterized by itchy and sometimes painful, thickened skin lesions that can occur anywhere on the body, including the face. This complex disease involves the immune system, genetics, environmental factors, and even lifestyle. In fact, we're only beginning to unravel the complexities of this disease. We now know that having psoriasis is more than skin deep. People with psoriasis have an increased risk of cardiovascular disease, metabolic syndrome, obesity, and other immune-related inflammatory diseases, and even skin cancer. As you can see, this is a very complicated and serious disease that goes beyond the surface of the skin. So who gets psoriasis? Men, women, children, even celebrities get it. Psoriasis is seen worldwide in all races and in approximately 125 million people. In the US, it currently affects 7.5 to 8.5 million people. Psoriasis occurs in both children and adults and may appear at any age, although it's most commonly diagnosed between the ages of 15 and 35. People who get psoriasis usually have someone in their family who also has psoriasis. For people with a family history of psoriasis, about 75% of them get it by age 40. Let's establish that psoriasis is not contagious. Treating a client with psoriasis will not give you the disease, so don't be afraid to touch the skin of someone with psoriasis. Psoriasis typically looks like red or pink areas of thickened, raised, and dry skin. It affects areas over the elbows, knees, and scalp, although any area may be involved. It also tends to be more common in areas of trauma, abrasions, or repeated rubbing and use. Psoriasis comes in many different forms. It may show small, flattened bumps, large, thick plaques, round red spots, or flaky skin. These are the 5 main types of psoriasis. Let's look at these more closely. About 80% of people living with psoriasis have plaque psoriasis. This is the most prevalent form of the disease. Notice the raised, thickened patches of red skin covered in silvery scales. These are called plaques. This usually appears as small red bumps, which can then enlarge and form scales. This leaves the skin dry and sensitive. Skin can itch, burn, bleed, and crack. In severe cases, the discomfort can make it difficult to sleep and focus on everyday activities. Plaque psoriasis can also occur on the scalp. The scalp could have fine, dry, scaly skin or heavily crusted plaques, as you see here. Sometimes psoriasis of the scalp is confused with seborrheic dermatitis, a type of eczema. A key difference is that in seborrheic dermatitis, the scales are greasy-looking, not dry. About 10% of people who get psoriasis develop guttate psoriasis, making this the second most common type. This often develops in children and young adults who have a history of strep infections and can also appear after infections from chickenpox, tonsillitis, or even a cold. In guttate psoriasis, drop-sized red dots form, usually on the trunk's arms and legs. Pustular psoriasis occurs in less than 5% of people who develop psoriasis and primarily occurs in adults. There are 2 forms of pustular psoriasis: generalized and localized. Generalized pustular psoriasis is a rare and severe form of psoriasis that can be life-threatening, especially for older adults. Localized pustular psoriasis is confined to certain areas, usually the palms and soles. This is also known as palmoplantar psoriasis. The nails can be involved, where they can turn yellowish, pitted, and peel away from the nail bed. Skin is left red, swollen, and dotted with pus-filled lesions. Using hands or walking can often be painful. Inverse psoriasis is shiny and smooth without silvery scales. It's usually found in areas such as the armpits, under breasts, and in between skin folds. It is more common in people who are overweight or who have deep skin folds where sweat and friction tend to make the condition worse. Also known as exfoliative psoriasis, erythrodermic psoriasis is the least common type, occurring in about 1 or 2% of people who develop psoriasis. The skin looks as if it's been burned with severe redness and shedding of the skin that covers a large portion of the body. This can be life-threatening because the skin loses its protective functions against loss of heat and fluid, as well as in preventing harmful bacteria and other substances from entering the body. Those are the 5 main types of psoriasis, but overall, psoriasis can be mild, moderate, or severe. People with psoriasis on less than 3% of their body are considered to have a mild case. Those with 3 to 10% of the body affected by psoriasis are considered a moderate case. More than 10% is considered severe. Now that we know what it is, we can ask, what causes this disease? The truth is, no one knows exactly what causes psoriasis. However, we do know that the immune system and genetics play major roles in its development. Scientists believe that at least 10% of the general population inherits one or more of the genes that create a predisposition to psoriasis, with only 2 to 3% of the population actually developing the disease. These gene defects cause abnormal immune function. Most researchers agree that the immune system is somehow mistakenly triggered, which causes a series of events, including acceleration of skin cell growth. In psoriasis, T cells, a type of white blood cell that hunts down invaders as part of your body's natural immunity, do not work properly. For some reason, they are hyperactive and end up on the skin, causing inflammation. A normal skin cell matures and falls off the body in 28 to 30 days. A skin cell in someone with psoriasis takes only 3 to 4 days to mature, and instead of falling off or shedding, the cells pile up on the surface of the skin, forming plaques and lesions. Genes, environmental factors, and internal stress can come together as a perfect storm to trigger psoriasis. The end result is a cycle of skin cells growing too fast. Just as many factors are involved in the development of psoriasis, the disease can also affect other bodily functions, including the joints. Arthritis will become an added issue in up to 20% of people afflicted with psoriasis. Understanding your own personal triggers and tripwires is vital for effective management of the disease. What are some common triggers to look out for? Winter can be especially hard on those who live with psoriasis. Cold, dry weather can worsen psoriasis, while warm, sunny climates may help alleviate it. Stress is known to make psoriasis worse, and having psoriasis can make you more stressed out, resulting in a vicious cycle. Repeatedly piercing the skin and injecting it with dyes is major trauma. Trauma to the skin can cause new lesions to appear, and can also lead to infection, another psoriasis trigger. Think twice about tattoos and acupuncture, and consult a doctor about injections. Lifestyle factors may also affect psoriasis. Certain medications, diet, drugs, even smoking can all trigger psoriasis. A depressed immune system and hormonal changes can also trigger it. Of course, these are daily factors that vary with each person. As a professional skincare therapist, it is important not only to remind clients to avoid their specific triggers, but also for you to be aware of them each time they come in for a consultation. There are many medical options available depending on the classification and severity of the disease. These are some forms of treatment a doctor may prescribe. Topical treatment, such as corticosteroids and vitamin D3 analogs. Oral or systemic treatment. Light-based treatments, such as UV light therapy. New drugs called biologics or biologic agents are designed to target very specific parts of the immune response. Other treatments, like taking vitamin D supplements and having a gluten-free diet, are lifestyle choices that may also help the person with psoriasis. Although there is no cure, there are ways to manage symptoms, and gaining this knowledge will lead to more satisfied and educated clients. Remember to always check with the client's physician for contraindications due to medications and therapies. The skin of people with psoriasis is flaky, dehydrated, sensitive, and inflamed. In the treatment room, if these cracks are open and evident, even water on the skin may sting the client. Calming compresses may be your only option in this scenario. Your goal is going to be to gently exfoliate cell buildup if the client is not contraindicated due to their medication. Softening the plaques and promoting barrier repair can help prevent cracks and provide more comfort to the psoriasis sufferer. Use the less rule: less friction, heat, time, and products used on the skin. Instead, use soft cloths or sponges to gently cleanse and exfoliate the skin. Exfoliants should only be used if the plaques do not present any obvious cracks. You can choose to test on a small area to evaluate skin response and client feedback before proceeding with the treatment. Always check with a dermatologist first before using exfoliating ingredients. Some exfoliating ingredients, like salicylic acid, may counteract the effects of some medications, so be prepared before treating the skin. Chemical exfoliation may be preferable to mechanical exfoliation with scrubs or beads, as these can get under plaques and cause more inflammation. Look for ingredients like lactic acid or enzymes like papain and bromelain. Shampooing or massaging an exfoliating product into the scalp may also be performed on scalp psoriasis. Instead of hot steam, use a Dr. Lucas vacuum or eco-spray. This can help with removal of products and provide additional hydration to the skin. Moisturization is key. Hydrating masks, serums, and emollient moisturizers can help ease the dry, irritated skin of psoriasis. Balneotherapy, or bathing in warm water and sea salts, can also be beneficial to soften hard plaques and comfort the mind. There is a psychological component to psoriasis, so incorporate stress-relieving techniques to help control inflammation and lower stress hormones. Complementary therapies like aromatherapy, Chinese acupressure, reflexology, Thai and shiatsu massage, together with meditation and breathing techniques, can be coupled with skin and body treatments for effective stress relief. These are some soothing ingredients that are helpful in reducing inflammation and repairing the barrier function, which you can incorporate into your treatments. Stick to physical sunscreens like zinc and titanium, as these are less irritating to sensitive skin. Psoriasis is a lifelong disease which requires daily attention. Home care is essential. Here are some additional tips to share with your clients. Avoid trigger factors to help prevent flare-ups. Establish a skincare routine and stick to it. Bathing daily helps remove scales and calm inflamed skin. Mineral salts dissolve on contact with water and allow enzymes to work without rubbing. After bathing, use a moisturizer and reapply often. Recognize and manage stressful situations and seek emotional support. Adjust your diet. Studies show that gluten may be a trigger factor for psoriasis. Check with a doctor first before making any major dietary changes. Of course, all of these will vary on the individual, so take the time to listen to your body. As a professional skincare therapist, you can provide your clients with the necessary education to help them comply with their prescribed skincare regimen, as well as your technical expertise in getting and maintaining results for this potentially debilitating skin condition. To find out more information on sensitive skin, log on to dermalinstitute.com. Thank you for joining me. To receive a copy of the notes for this webisode, fill out a short survey on the link provided.